inshallah. For today, we will continue with the urinary system. Last time also we discussed the blood supply to the kidney, and we will continue with that. We will continue with the nephron. So, about the blood supply to the kidney, we said that the blood supply, the arterial blood supply, it came from what? From which artery, main artery? The main artery that the branch aorta, which part of the aorta? Abdominal aorta. So from the abdominal aorta there is the artery which is called renal artery. So there is renal artery which supply the kidney. Is it one artery or two? Two artery, one right and one left. So renal artery, right and left renal artery. The right it will supply the right kidney, and the left it will supply the left kidney. So the kidney, as we said before also, it has to have a rich blood supply. So it needs a rich blood supply in order to, because it filtrates the blood and it is continuously getting rid of the waste product from the kidney, from the blood. Sorry. So about 1/4 of the total blood supply, it passes through the kidney in each minute. We said how much of blood do we have in our body? 5 to 6 liters. So in each minute around 1.5 liter is passing through the kidney from the 6 liter which we have. So continuously the blood supply, it is a very huge amount of blood that is coming to the kidney. So we answered this question. So those are the blood supply. Again, the blood supply to the kidney, it came from the renal artery, which is coming from the abdominal aorta. So it is a branch from the abdominal aorta. The renal artery, the right and left renal artery are there. Then from the renal artery, it will go, there are branches, which is the segmental artery. Segmental artery, it will go to each segment. There is an artery which go to each segment of the kidney. Then we have the lobular and interlobular artery. This is the segmental. From the segmental, we have lobular artery, and here the interlobular artery between the lobules. Then what we call this part of the kidney? This part, did you remember? From the shape of it, the name of it, it is coming from the shape. Pyramid. So around the pyramid, there is what we call it the arcuate artery. Arcuate artery, which is coming around the pyramids. And there is the interlobular artery. Interlobular artery. Those are fine arteries that coming in between and the cortex of the kidney. So this is the arterial blood supply. Then the venous return of blood, it will come back through the end that it is coming from the artery. So the end is the interlobular artery. So the vein, it is the interlobular vein. Taking from the capillaries. Then the arcuate vein, it's the same. We have arcuate artery. Then we have also the arcuate vein. Then interlobular vein between the lobules. Then it will take back the blood to the renal vein. So then, as we said, it will go to the renal vein, from the renal vein to the subclavian, to the inferior vena cava inferior. So this is the blood supply of the kidney, the blood supply to the kidney. So in the kidney, the main unit, the main functional unit of the kidney, it is the nephron. So the main functional unit in the kidney is the nephron. The nephron, as we said, the blood supply to the nephron, it is coming from the aorta, renal artery, segmental artery, lobular artery, interlobular artery, arcuate artery, intralobular artery. Then it will go to the Bowman capsule of the, we will come to the parts of the nephron, to the Bowman capsules. There is capillaries are there, the arterial part of the capillary. Then it will go back to the venous part of the capillaries. The prelobular, it will go back to the prelobular capillaries and via the then intralobular artery, arcuate vein, interlobular vein, renal vein, then inferior vena cava. So this is the blood, the circulation of blood to the kidney, going to and back to the heart. Now, about the nephron. The nephron, as we said, are structured and the structural and functional unit of the kidney. There are millions of nephron, 1 million nephron in each kidney. It might be more than that. The responsibility, it is the main functional unit of the kidney. So all the processes, it is going inside, it will go inside this unit, which is the nephron. It is responsible for the formation of urine. So the formation of urine, which is extraction of all waste products from the body and sending it to the out of the kidney to the ureter, then to the bladder, then outside of the body. The nephron, it consists from two main parts. The first part, which is the glomerulus. This one, this part, it is the glomerulus, which is a count of capillaries. It is network of capillaries inside the glomerulus. Then the renal tubules, those tubules. So it is consist of the glomerulus and long tubes are coming from it. See, that tube is coming down and up and going around the glomerulus. All of those kinks, all of those part, it has a function in the urine formation process. So we will come to their function and how the urine is formed in the kidney. So this is, as we said, this is the Bowman capsule in the glomerulus. So the glomerulus and Bowman capsule, and the proximal, this is the proximal convoluted tubule. Proximal convoluted tubule. So the filtrate which is coming out from the capsule, it will go to the proximal convoluted tubule. See, follow, there is some small ball is moving. If you see it inside. Again. See? So this is the movement of the urine. See how it is going up and down inside the kinks of those tubules. Then this is the longest part of the tubules of the nephron, which is called the loop of Henle. Loop of Henle. So this part, it is called the loop of Henle. So proximal convoluted tubule, loop of Henle. Then we have the distal convoluted tubule. See, in the distal convoluted tubule also it is here the loop of Henle, it is coming down and going up. Then the proximal convoluted tubule is coming up and going again around the Bowman capsule, around the glomerulus. Then we have the urine, it will go to the collecting tubule. Those are a collecting tubule, that the urine are collected from many nephrons. See here, there are many opening. It means that many nephrons are giving the extract of urine to those collecting tubule. So again, in the Bowman capsule here, it is full of, rich of capillaries, venous and arterial capillaries. We will come to how they are working. Then the filtrate, or it will come to the proximal convoluted tubule. Then from the proximal convoluted tubule, it will go down here to loop of Henle, and it will come up. This is the end of the loop of Henle. Then the distal convoluted tubules. Then from the distal convoluted tubules, it will go to the collecting ducts. It will go to the collecting ducts. About the blood supply to the glomerulus and to the Bowman capsules, there is an efferent artery. Efferent, it means the artery that is coming in. So it is efferent arteries. So this is the glomerulus or capillaries. It is blood supply from the efferent artery. Then the blood, it will go out through the efferent arteries. The size of the efferent artery, it is larger than the efferent arteries. So it means that it will exert more pressure inside because of this larger artery here, and the blood, it has to go back through an small efferent artery. So this will exert pressure and will lead to that fluid will come out from those arterioles. So what will happen? So the glomerulus is a specialized capillary bed. It is a specialized capillary bed. It is full of capillaries. Are you following me?
Yes.
Huh? Did you understand what we mentioned before?
Yes.
Any question up till now? So the glomerulus capsule is a specialized, as we said, capillary beds. It's attached to arterioles on both sides. That will maintain, as we said, maintain an high pressure because the efferent is larger and the efferent is smaller. So the amount of blood which is coming, it is more, and the amount that it has to go back, it will go through a small artery, so the pressure, it will increase. So it will maintain high pressure. So large efferent arterioles, as we said, and narrow efferent arterioles are there. Then we have pretubular capillaries. Here, pretubular capillaries going around the, what we call this part, this tube. What we call this tube? Huh? This part. What we call it? When it is near, we call it proximal. So it is proximal convoluted tubule. This one, which is far, it is called distal convoluted tubule. So this is the proximal convoluted tubules. Here, the pretubular capillaries are going around this part. What's the purpose of that? Here, some filtrate are coming, and it's coming through those tubules. Blood vessels are going around them.
Complete filter.
Sorry?
Complete filter.
Complete
Filter.
filtration? No, filtration, it has happened inside here. Filtration, it will happen here. But here,
Absorb.
reabsorption, yes. So thank you. Now, reabsorption, the way of reabsorption. Reabsorb the thing that is escaped from the Bowman capsule from those arteries, and the body still is in need for it. So it will be again reabsorbed. So again, efferent, and those are the tubules here. Rising from the efferent arterioles of the glomerulus, normal low pressure capillaries. So from the efferent arterioles, which is coming out from the glomerulus, there will be normal or low pressure capillaries. Here the pressure, it was high. Now the pressure is becoming low. So it is attached to the venules. So the blood pressure, it will go down in order, because the blood pressure in the vein, it is low. So the pressure is starting to come down in the venous, clink close to the renal tubules. They are clinking there, attached to the renal tubules, for the purpose of reabsorb or reclaim some substance from the collecting tubule. So it will reabsorb the needed substance for the body. So the filtrate, which is filtrated there in the glomerulus, it is very high. So due to high pressure, due to osmolarity also, difference in the pressure and difference in the osmolarity, there will be more fluid escaping from the blood vessels, from the arterioles there. So that fluid also, it contains some substances that the body still is in need for them. So when the blood is coming out, the concentration of those substances, it will be less or high or low after filtration? Low, it will be low. So it will be lower than the filtrate, which is coming here in the proximal convoluted tubules and lobe of Hill, and also the distal convoluted tubules. So what will happen? The substance which is needed, it will be selective reabsorption. It will be reabsorbed again in the body, and also it will start to be concentrated. So also some of the water, it will be reabsorbed again. So again, this is in the nephron, this is the glomerulus, this is the efferent arteriole. See the difference between the size of the efferent and the efferent arterioles. The efferent, which is coming in, the efferent, which is coming out. So the size is different. Here it is small. So this will create, as we said, more pressure here. And those arterioles here, it is thin arterioles, so it will lead to escaping of fluid due to the pressure, to the high pressure. It will be escaped from the high pressure to the lower pressure. The pressure outside the blood vessels here in the Bowman capsule, it is low. So the fluid, it's going from high pressure to the lowest pressure. And the concentration of also the all minerals and urea, it is low, so it will go out of the blood vessels. So when the blood is coming out after that, the pressure, it will decrease, it will come down. So this is the glomerulus capillaris. Glomerulus capillaris is there. Then glomerulus Bowman, this is what we call it. This is the Bowman capsule, this part. So this is the whole thing, it is the glomerulus. This is the Bowman capsule that the fluid is coming inside. This is podocyte, we call it. So the podocyte of the inner capsule form a very leaky membrane. It is a thin membrane, and it is due to high pressure, it is a very leaky membrane. Very leaky, it means that the fluid is coming out from them. So membrane around these capillaries, which is around those capillaries, so it will lead to leakage of the fluid which is coming from the blood. This is, we call it the capsular space. So the filtrate, it is accumulated here, and then it will go through this canal. This is from the part of the proximal convoluted tubules, this part. So it will be collected here, and it will escape, it will go through the proximal convoluted tubules. Is it clear?
Yes.
So about the nephron, also we have two types of nephron. We have the cortical nephrons, this part, which has a short loops here. It is coming in the upper part of or the around the kidney here, and the other, which is what we call it the juxtamedullary nephron. So juxtamedullary nephron. Here, the difference that it has a long loop of Helen. It is going down through the pyramid. It will go down. So it is more longer. So the cortical nephron, it is present in the renal cortex, and the other, it's present in both, in the cortex, part of it in the cortex and part of it in the renal medulla. So again, this is the nephron. Here it is the efferent artery. This is the efferent artery. Then it will go out and it will go around the all loops, the all parts of the tube, which is coming out from the glomerulus, from proximal convoluted tubule to loop of Henle to the proximal convoluted, to the distal convoluted tubule, and back to the collecting duct. So the blood vessels is going around all of them. So, and a huge network of capillaries are there. So this is about the nephron and how they are formed. Then when in the next session we will continue with the urine formation. Do you have any question related to this part? Any question is there? Okay, thank you.